Hello everyone, welcome to this ECG course. Today we will start a series of lecture about ECG and I collect some useful information in these videos, and I hope you will follow us and also subscribe our channel for more video. So today we will start our lesson with the first part of ECG, ECG part 1. So we will start our lecture with the learning objective, that what is the basic concept in this course and what will you learn if you follow us. So the first and the very big thing is that what is ECG. What is ECG? So electrocardiography or ECG is what, and also why we are studying ECG. So what is the importance of ECG, and also what is ECG leads, the special things which record the ECG from the patient called leads. So what are these leads? So we will explain it later. And also what is electrocardiography, the process we take ECG, and also what is electrocardiogram, and also electrocardiogram is a special type of paper which is used for ECG, and also we will explain these things later. And also how normal ECG look like, so we will know normal ECG. This is very important thing, and also very important, and the things that all the ECG studies for that is clinical uses of ECG. So what is the clinical importance of ECG? So we will know about it later. So let me first explain the ECG or electrocardiography, that what is ECG. All of us know that the heart has a special electrical activity. So this electrical activity is stored from SA node, which is located in the superior lateral wall of the right atrium. So when it produces electrical impulses, it spread first to the atrium, and then it come to the AV node, and from AV node it go through the His bundle to the ventricle. So when we want to record these electrical activity of the heart, it is called electrocardiography actually. So we can easily say recording of electrical activity of the heart is called ECG. So recording of electrical activity is electrocardiography. So ECG is the abbreviation of electrocardiography. Electro mean electricity, cardio mean related to cardia, related to heart in graphy. So we can easily know that the recording of electrical activity is called ECG. So first in the very basic concept, I want to open your mind that why we are studying ECG. So we should know uses of ECG, that in a very big field we can use ECG in the clinic. So we can use to diagnose the hypertrophy of heart chamber, and also we can use to diagnose myocardial ischemia and heart infarction. So for the diagnosis, when we take the ECG of the patient, so which who have the hypertrophy of a heart chamber, so the ECG will show a special type of changes. So we know that she or he have the atrial hypertrophy or ventricular hypertrophy, and also we can use it in myocardial ischemia and heart infarction, and also we can use it in the cardiac arrhythmia. We can diagnose these things with ECG, and also we can use it in pericarditis. So when a patient comes with pericarditis, and we do our physical examination, also other examination, so then we give him some laboratory tests. So one of the tests is ECG, one of the diagnostic method is ECG. We can use it to know that he or she have the pericarditis or not. Also systemic disease which affect on heart, so we can easily diagnose these disease by ECG of the patient. So ECG is very important. Also drug effects on the heart. Also when we give a drug to a person, so we can easily see the changes or the effect of that drug and the heart rhythm in the heart ECG we can diagnose it, and also other cardiac problem we can use ECG. And then the other thing is ECG leads. So what is leads? I will explain that what is leads and how many types are these. So first thing, the leads is the very basic answer, because these leads are the tools we can record ECG with that. So leads are electrodes. These are electrodes which are recording ECG from the patient. So the electrodes which are using to record the ECG of the patient or electrocardiography of the patient is called leads. So they are electrodes, special type of electrodes used to record ECG. They are called leads. So as you know, the heart is a more dimensional organ, so we need more needs or number of needs to record the electrical activity of the heart. We need a number of electrodes to record the heart electrical activity. So usually there are 12 leads we use in ECG to record ECG of the patient. So welcome back. So we'll start it with the types of the lead. How many types of leads we have? So mainly we have three types of leads: bipolar standard leads, unipolar leads, and also chest leads. So what is important for a doctor to know? That only we should know that how many leads we have and how we can use it, and also what is the function of these leads. So first we will explain this in red color: bipolar standard leads. So what is bipolar standard leads? Bipolar standard leads show, so they, as their name, they are bipolar. So these leads show the potential gradient between two extremities. Actually they show a potential gradient between 2 points. So as because they show the potential gradient between 2 points, they are called bipolar leads. So usually we have three of these leads named lead 1, lead 2, and lead 3. You should just know that where is lead 1 located, where is lead 2 located, and where is lead 3 located. And the very basic thing is that about bipolar standard leads, that they record the potential gradient from 2 points or from extremities. So L1, so this is very important, that where is L1 located. L1 show the potential gradient between left arm and right arm. You can see it, lead 1. So the positive electrode is located in the left arm and the negative electrode is located in the right arm. So this is lead 1. It show potential gradient between left arm and right arm. And then we come to lead 2 in the red color. Lead 2 show the potential gradient between right arm and left foot. This is lead 2. It show the potential gradient between right arm and left leg. And also we come to lead 3. Lead 3 show the potential gradient between left arm and left leg. You can easily see that this is lead 3. Show the potential gradient between left arm and left leg. So the negative electrode is of lead 3 is located in left arm, and the positive is located in the left leg. You should know this triangle. It is called Enthovian triangle, and you should know the leads, lead 1, lead 2, and lead 3, and where their positive and negative electrodes are located. It is very simple. So lead 1, only lead 1. So we have 3 leads. So lead 1 positive is in the left arm, and also other two leads positive are in the left leg. So lead 1, if the positive is in the left arm, so the negative will be in the right arm. And lead 3, if the positive in the left leg, so the negative will be in the left arm. So in lead 2, if the positive in the left leg, so the negative is remain, the negative will be in the right arm. So also you can see the ECG machine which record, it is movable and record ECG from the patient. Then we come to another type of lead, unipolar leads. So they consist only positive electrodes. In bipolar leads we have two electrodes, positive and negative, but in unipolar leads we have only one electrode, which is positive electrodes. So the other electrode is measured as a constant point, and they show the potential gradient between that constant point and one of the extremities. Usually again we have three of these leads, AVR, AVL and AVF. So you should only know where they are applied. So AVR, R is for right, applied to the right arm, and AVL, L is for left, applied to the left arm, and also F is for foot, applied to left foot. Then you can see these leads. AVR, as we say, it applied to right arm. So this is AVR applied to the right arm, and then AVL applied to the left arm, and then AVF applied to the left leg. AVF, this is AVF applied to the left leg. If we connect these leads together like this, so they will come together in a point which is the constant point, and we told that this is these leads show or record potential gradient between these extremity and this constant point, so they are unipolar leads. And then the last one, the chest leads, which are also called unipolar pericardial leads. They are also unipolar leads. They record potential gradient between 0 point and different point of chest. So we have 6 of these chest leads. So as they applied to the near to the heart, so they are called unipolar pericardial leads. We have 6 of these leads. You just should know the location of these nodes, that where we can apply these leads. So very simple. We have these 6 leads like V1, V2, V3, V4, V5 and V6. So from V1 to V6, these are the 6 lead names, and also where they are applied. So you can say this is first rib, this is second, this is third, and this is fourth rib. So this is first intercostal, second intercostal, third and fourth. So V1 and V2 are applied in the fourth intercostal space. V1 is in the right side and V2 is in the left side. Then come to V4. So V4 is applied in near to the fifth intercostal space. In V3 is between V2 and V4, and then V5 and V6 both are in the fifth intercostal space, but V5 is in the anterior axillary line and V6 is in the middle axillary